Today I'm going to talk about what's wrong with IBS medicine and a couple of tips for doing it right, so stay tuned. If you're a returning viewer, welcome back, and if you're new here, welcome for the first time. My name is Amanda Malacheski, and I'm a certified functional nutrition health coach, and I'm also the host of the Calm Digestion Method online program that supports people with IBS and SIBO. For weekly videos on how to find your personalized diet and supplement plan for IBS and SIBO, please consider subscribing and be sure to hit the bell to be notified when I post a new video. I've met an awful lot of IBS patients in the last 2 years, and one of the very most common things that I hear from you is that you're very unhappy with the medical care that you're getting for your IBS. As a professional gut health coach that supports patients with IBS and SIBO, which is very closely related to IBS, I have a unique front row seat to what's working and what's not working for IBS patients in their medical care and in their journey to try and find digestive wellness. And I've taken what I've learned from that and what I've seen work for my clients and transformed that into a new approach that I think is much more sane and more efficient and makes a lot more sense. So that's what I'd like to talk to you about today. So let's get started. All right. So if you're someone who's been experiencing abdominal pain and bloating and either constipation or diarrhea, along with maybe some brain fog or fatigue, it's not at all unlikely that you will have at some point decided to reach out to your doctor to try and get some answers about why is this happening and what can I do about it, especially if your symptoms are making it difficult for you to work or go out or do any of your normal activities. But what so often happens is your doctor or the gastroenterologist that you were referred to runs this huge battery of tests, some of which are very invasive, and they come out the other side and say, well, your tests all look normal and there's nothing really clear here, so you have IBS. I'm not really sure that doctors realize the psychological impact on their patients of hearing this after they've not only been suffering, but have also subjected themselves to this long diagnostic process. So to follow that, the first major thing that I feel is wrong with IBS medicine is this very process of diagnosing IBS. This conventional process of ruling out every other possible diagnosis before saying, oh, you have IBS is just kind of asinine. And sadly, it doesn't even really get you any closer to any answers about what you can actually do. So there is a much easier, much more streamlined way to diagnose IBS as long as there aren't any obvious huge danger signs or symptoms for you. There's 2 simple tests that can help you either confirm you have IBS or that you need to dig deeper for something else. And those 2 tests are, number 1, the IBS SMART test, which is a simple blood test that your doctor can order. And the other is a SIBO breath test, because we know that approximately 60% of IBS cases are caused by SIBO. If either of these tests are positive, it's pretty likely that you have IBS, especially the IBS SMART test. This test has something like a 98% sensitivity and specificity, which is just a measure that determines how accurate is this test to rule out the condition that it's testing for. And if you add in the GI MAP stool test as well, you also have a pretty complete picture of the possibility of infectious causes of IBS that aren't SIBO, as well as some digestive health markers that are very helpful in ruling out IBS by other causes. It seems to me that this is a much more to the point and efficient use of patients' resources and time. It's way less invasive. It's way less uncomfortable. It may be a little more expensive out of pocket, but you are maybe going to get to answers a lot faster. The second major problem with IBS medicine is that many of the things that can really make a difference for patients in their day-to-day life are diet and lifestyle changes, some simple things that everyone can do at home. But a lot of doctors' practices don't have the time or the resources to support their patients in making those changes. Thankfully, many doctors nowadays are recommending the low FODMAP diet, just as an example of a dietary theory that has research to back it up for IBS patients. But they'll recommend this to their patient and send them out the door with a 1 or 2 page handout or say, just look it up on the internet. And there's so much more to implementing this diet and getting important information out of it than just reading through a simple handout. Having worked with hundreds of clients at this point, I can unequivocally say that 1 to 2 page handout is nowhere near enough information for IBS patients to make those dietary changes with. There's a lot more to it so that you can get the maximum amount of benefit from it. Now, I know that most of you likely have hundreds of questions every single week about how am I supposed to use this supplement? Should I change this diet? I heard I was supposed to eat this and not eat this during treatment for SIBO, XYZ. And maybe even you have questions about the treatments that your doctor recommended in terms of like how to use them, when to take them, should I take them with food or not, or whatnot. Something I've noticed is that because digestive symptoms are so variable and complicated, IBS patients need so much more support than they're often given by their doctors or other practitioners. The good news is that getting help with a coach like me or someone like me can really be helpful for you on your journey to help make navigating that process way easier, simpler, way less overwhelming. And it can help you just make better progress with your process. The third major problem with IBS medicine is that once you have that diagnosis, typically everything from that point forward focuses simply on symptom management and reduction rather than asking the very extremely important question, why are these symptoms happening in the first place? Now, I suspect that for most of you, a lifetime of symptom management medications is not really in your dream future. And though those medications may have a place in your long-term management situation and you may need some of them, you owe it to yourself to ask this question, why are my symptoms happening? And can I understand those underlying mechanisms so that I can address them and actually clear those at an upstream level rather than relying on downstream solutions for the rest of my life? And though the conventional wisdom is that there isn't a clear underlying cause for IBS, I find that in most cases there are clear underlying causes. It's true that there's not one single underlying cause for all IBS, but there are a handful of common underlying causes, and if we can methodically investigate these, we can get to the point where we often understand what is causing your IBS. It may not be easy, but with the right process of inquiry and experimentation, you can figure out what these root causes are for you. And once you actually have a name or names for the things that are causing your symptoms, then you have the potential of choosing a path of action that actually can fix that problem. This is one of the many ways that I support my clients inside my Calm Digestion Method program. I help them figure this stuff out. So if you're struggling to find the appropriate help that you need to manage and clear your IBS, and you've been frustrated with your particular experience inside the medical system managing your IBS, I want to encourage you to grab a copy of my new book called What's Wrong with IBS Medicine, an IBS health coach's advice on how to navigate IBS treatment for success for IBS patients. I'm going to leave a link below this video to Amazon where you can grab that either as an ebook or as a paperback book. And I also want to let you know that I do have a full-length book coming out, hopefully in about a month. So stay tuned for that and make sure to subscribe so you'll be sure to get notified when that comes out. I wrote this book for you so that you can visualize a new pathway to resolving your IBS symptoms, one that really meets you where you are and is as efficient as possible. So please do go check it out. Let me know if this video was helpful or useful for you by clicking like, or even better yet, leaving me a comment. And don't forget to subscribe if you like what I'm talking about here. And next, you might want to check out my video, How to Heal IBS and SIBO Naturally. So I will see you next time. Take care.